I have been wanting to make a video about our health care for about 4 or 5 months since I've been traveling in Guadalajara and have watched what is going on in America. I didn't really know before how to address this matter. First thing, my name is Sandra Leonard. I am a senior. I call us people of substance. They don't really, cover us that much or at all in the media. Right now, this is an enrollment for Medicare. And most seniors that are my age, most of them, some of them can't walk, some of them can't talk, some of them can't see, some of them can't read. You are dependent on your family or healthcare providers who really don't care about us. So I felt so compelled to write about Medicare and the Advantage plans and the insurance companies and all of the things that are driving the healthcare system up. Now, I did read on Medicare.gov about how Medicare is trying to push away the Advantage plans that these insurance companies have put in place for seniors. Now, when you do an Advantage plan, they'll come and tell you all these great things. You can go to the gym. You can you can't select your own doctor. You can forget about that. And really, most clinics or doctors in America don't even want the Advantage plan. But there is a plan that is wonderful if you sit down, think about it. It's called the 20% plan with no frills that works with Medicare. Medicare pays 80% and you pay 20%. It's a small amount out of your pocket. Now, you've been bombarded with so many pieces of paper, mail, text messages, robocalls, and all of these things. And I sit in clinics and doctor's office and watch our people of all nationalities, it doesn't matter whether you're black, green, or white, come in. They're told to sign all of these papers. Half of them are sick. They can't read, and it's just awful. I have been very fortunate through my life in the last 25 years to travel all over the world as a merchant marine. Now, what I did for myself, I got up and I left America because I could not depend on a family member or anyone to take care of me. And I felt like I wasn't going to ever really make it. The insurance companies that I was connected with, they wanted me to pay a premium. Then they discontinued your medicines. Then they said to you, well, you can't get a brand medicine at all. You have to take a generic medicine. And if the pharmaceuticals people don't make money off of, say, a blood pressure medicine, they will just discontinue it and tell you, okay, you have to take this medicine. And that's what's happening in America. And then you go to the doctor, or say, for instance, you had an accident, such like I did. I had a broken shoulder. They want to give you Vicodin and all of these other, morphine or whatever. And you have to take control of your life. You just do. You cannot depend on anyone else. You have to sit down, be quiet, get spiritual, and have a plan, period. Now, I'm not going to say that everybody has to be proactive as I was. I got up when I realized that I didn't have anyone around me to take care of me, who cared about me. I got up and I went to Mexico on my own. I started out in Mexicali. I ended up here in Guadalajara. I did get very sick with salmonella, And that's amazing for me to get sick with salmonella because I'm a chef and have been through all kind of health programs. Because when you cook, you have to worry about bacteria and all, and I knew all that, but I fell short. I ate some chicken in a little small place, and I got deathly ill. But within that frame, I got into their medical system, and I was treated free at a clinic with all the drugs that you needed, all the intravenous things that you needed, I was given. Then I found a wonderful, wonderful young doctor here. I go in to see him. My medication, they were all generic. This man gave me all the premium brand that I needed. The peso's very low here, so our medication is very cheap. You go into the pharmacy, you show what you need. If you're using a drug that or antibiotic, or if you're using something like Xanax or something, you have to have a prescription. You have to. And you also have to have it copied because they don't want duplicate doctors giving you medicine. And another thing, you have to have a passport to travel. So that's my ID. Now, you're going to say, well, why is she making this video? I'm making this video because our health care is horrible for us. And the starting of the health care bill was in 1965 by Lyndon Baines Johnson. And he had a vision before Kennedy died, he also had the vision. And Lyndon Baines Johnson just took it over. Now, also in that, for low-income families, you had Medi-Cal. Then you had AFDC, where they could get cash money for children, pregnant women. All these things were put into place. But all of that has dissolved right now. I have someone in my family that's young and getting ready to have a baby, and she can't even hardly get any cash assistance because most people don't know the system that they are taken care of. When you go in, you're bombarded with all these papers, and they don't know, to show you how to fill them out. It's just awful, really. Like I said, I'm not saying that no one has to do what I do or did. I will be coming back to America, and there are certain things that I need to do, but I don't know if I'm going to even live in America. I really just don't know, because I want to take care of myself. I want to be healthy. I want to be healthy mentally. I'm a vegan. I'm not saying everybody has to be a vegan, but when you get to a certain point in your life, you can't have sugar, you shouldn't eat starches, and all of these things that they are telling you to eat. Between the pharmaceutical companies, the insurance companies, the food industry, you're lucky if you make it. I'm fortunate because I know how to take care of my food situation. I'm living in a place where I can cook and all kind of different things. Now, it hasn't been easy. It has not been easy. I've been discriminated against down here, but overall, people are lovely. And I respect the Spanish culture, and that's the best way that you can live in this world is respect each other, help each other when necessary, care. Because I'm telling you, you have to take charge of your life. There's no things on television, on cable, telling anything about what we should do as seniors in this planet. There's nothing. So you can just forget about it. And that's the reason I'm making this video. Now, I don't know who's going to see it. I really don't. I hope if it's 5 people that can pay attention to this, I'll be happy. Now, they talk about the president and the health care. It's not the president's health care bill that's doing this to us. In 2011, I went to college. I knew nothing about computers. And the one paper I did was for American health care bill for us. And in that bill, he wanted us to be taken care of. That's what the President of the United States wanted. But when all the insurance companies, the pharmaceutical companies, and all these people, the doctors and everybody got involved, I'm telling you, they have tore it apart. And we are sitting in the middle of it. When they tell you that Medicare is going to be dissolved in 30 years, that's not true, really. Because one thing about Medicare, the people that work at Medicare, they try to help you with your insurance. I have used them, and they're wonderful. But now this is the time that you are bombarded with all this paper sent to us, and there's no way that you're going to be able to read all this stuff. It's impossible. I was told by an insurance company, I was using the book, and I was told by the insurance company, well, it's outdated, so the doctors in there don't even matter. So I don't know why you're reading it. I'm telling you, that is what's going on in this country. And I hope someone, please, please listen to this video and take it to heart. And don't depend on anyone else. Depend on yourself and the Lord. That's the only way you're going to get through this, because no one else is going to help you. I don't care what they say. They just aren't. So peace, love, and caring is what we need on this planet.